My name is Jithangi Wanigasinghe. I am a child neurologist from Sri Lanka. I work at the Lady Ridgeway Children's Hospital here in Colombo. I'm also a professor in child neurology at the University of Colombo, and I am attached to the Department of Pediatrics. My work experience as a consultant is over 12 years, and the kind of patients that I see are mainly children with cerebral palsy and epilepsy. We also see children with central nervous system infections and also a wide repertoire of chronic neurological conditions. So, talking about my experience with regard to use of technology as a trainee, I would say that we had near zero exposure to use of technology. Even our exposure to EEG technology was minimal at the time of training, and use of technology was initially I witnessed mostly during my overseas training in Melbourne in Australia. But after my return, I think over the years, past 12 years, we are seeing gradual exposure to use of technology, and I think the main area we use technology is in the field of epilepsy, where we have started using more of technology for video and normal EEG recordings. But the extent of things that we can do in this field is vast, and I think there is a lot for us to expect over the years to improve. Talking about use of technology in rehabilitation, we are fairly backwards. We hardly use technology a lot. We lack exposure to use of technology in our assessments and also use of technology in treating patients. So, with regard to technology, we lack a lot in our exposure and also in our experience, although we have a vast number of patients where we feel that the use of technology can be very useful. So, what about the training support that we have with regard to that? Well, we basically don't have any support system. The information about technology that is available is basically extracted from the internet or from the conferences where we attend, where we see technology being used, and also from occasional visits to a laboratory where technology is used, where we see how technology is used for diagnosis as well as mainly for treatment purposes of patients. So, things like artificial intelligence is new words and new concepts to us, although we feel that there is a lot of scope for using artificial intelligence, use of evoked potentials, and also a lot of scope for using robotics and mechanical devices. Our use of devices is minimal. So, seems to be that there is scope for using this in our patients who have a wide repertoire of chronic neurological conditions, and also particularly in the field of rehabilitation, particularly in cerebral palsy. So, if you would ask me what would be my wish list with regard to this field of neurology and use of technology, I think my first wish would be I would wish that if I can be exposed to a world-class center in any field, since I have had some exposure in the field of epilepsy, I think I would like to see use of technology, robotics and artificial intelligence in the treatment of children with neurodisabilities. So, I think that would be my first wish, first to see what it is like and what is out there, so that we can think of where we need to be. Second one would be where we get training, particularly for trainers like us as well as for the trainees who are in training. It would be my wish that they would have an opportunity to be exposed to use of technology, and where we would have exposure to the technology in our assessment and our management of patients. So, finally, one wish also would be to a ready source of information with regard to this, and a link to an outside center, maybe one center or several centers, where we could have a collaboration with regard to use of bringing in technology to serve our patients. So, what we don't see, what we don't have experience, if we can have mechanism to make contact with outside group, where we can foster better relationships and also use the input from those centers to serve our patients, I think that would be my third wish.